And there's subtle little changes. Understanding that when, things like when sperm leave that testicle and go into the head of the epididymis, they're not actually motile. Okay? So there's other things that have to happen. That's why we have all those ciliated medusa cells in the head of that epididymis to kind of create a current to pull those spermatozoa out of the reedy testis into the head of the epididymis. So those are the things that I want us to know. Like I said, we'll go through that on one good day. But then, kind of understanding that there are final alterations or there are other ingredients in that seminal fluid that are completely necessary, and some are more specific than others. There are things that we actually call seminal plasma factors. There's certain cues that we don't know. For instance, in camelids, they are induced ovulators as well, and it's a very long mating process. But people have also determined that they can induce ovulation on these things by actually giving them injections of seminal fluid. So there's something else in the seminal fluid coming from the accessory sex organs, that plays a big role in actually, settling these females. It doesn't have anything to do necessarily with the sperm itself. So it is pretty complicated. Again, we'll focus on the cow, and then you can remember all the things that are different on the other species. Okay? So let's jump into these females and let's talk some anatomy. And hopefully you guys kind of caught my drift yesterday. Form leads to function. If you do not understand the anatomy, you don't understand the histology, you won't really truly understand what it's supposed to do. And thus, there is no way in the world you can tell anybody that something is wrong with it, much less fix it. And that's what we have to know. We have to know. So we want to just reach back through this stuff, and if there's something anatomically that, histologically, and again, I'm going to go only so far with histology. I have no desire to go back for a 3-hour laboratory and draw pictures with colored pencils. That's not what we want to do. But I need to know why that cell does what it does. And which cell, what is their major job? What's, you're made this way. You have a form, you have a function, because we're going to spend the rest of our careers trying to figure out what is normal, what's abnormal, and how can we fix it. Okay? So for most females, we're talking about, if we go from exterior to interior, we're going to have a vulva, we're going to encounter a clitoris, we will then enter what we call the vestibule, eventually the vagina proper, we will encounter a cervix, most of the time we'll be encountering an external os, cervical canal, and then an internal cervix, cervical os. We'll have a uterus, and all have different shapes and sizes, and then we'll have ovaries. And each one of these critters are going to have some nuances, but it really plays a big deal in what we can and can't do to some of these animals. And I'll give you some very specific examples. Just like yesterday, forgot that the boar has a prefusal diverticulum. You're not going to help that person diagnose what we call balling up when they bring you that cute little pot-bellied pig. And you're the one that's going to look silly when you end up with desiccated semen all over you when you go pushing on it and squeezing on it. So this I don't want to go to. We'll come back to this stuff. Let me skip down. We're going to come back to this stuff. Okay, so even within a cervix, there's a lot of differentiation here. This particular cervix is actually called a duplex cervix. So the challenge here is that there's multiple parts, right? I don't plan on working on any marsupials nor rabbits, but no, actually, the rabbit actually has 2 cervical canals. There's an individual cervical os for each half of that uterus. Marsupials have this, loop-de-loo like they do over in England or something. I just swim around and decide when they want to get off the turnabout. But, and still, to each horn, it has its own independent cervix there. Okay, This is what we're used to dealing with more commonly is a bicornuate uterus. You can look at the difference there between the mare and the cow and understand that the mare has much more, rudimentary type horns, distinguished from the difference in the cow, where we clearly have this very, very small uterine body, right? And it's all about the horn, okay? When we look at these mares, and we'll talk about these mares, it makes a lot more sense when you see that depiction, why that embryo can roll around from tip to tip for the first couple of weeks, first 2 weeks. That embryo can move back and forth and anywhere. You can ultrasound that mare every hour on the hour, and that embryo is likely to be in a different position within that uterus. Probably just not going to happen in the bovine. 99.9% of the pregnancies are going to be ipsilateral or on the same side, the same horn that she ovulated, the same ovary side that she ovulated from. She ovulates on the right ovary, she's probably going to have a right horn pregnancy, okay? And you can see how the body of that uterus has even a little cleft or division there. So we looked at our polytocious type species, our litter-bearing species, and you really start to appreciate the exaggeration of those horns. And we think about the bitch, the queen, and especially the sow. And sows, you guys, we'll talk about a little bit about sows real briefly. They'll be one of our things that if we don't get to it, I will give you guys, some information on it and kind of here's the things you need to know about sows. You guys will get some good reviews. You probably had did y'all have Dr. Gorham talk to y'all? He'll come back and usually give you guys an hour or two of review for Natalie and stuff. And so we won't spend too much time on it simply because it's so commercialized, okay? And they know exactly how they've bred these animals to be the most efficient, and they average exactly, roughly 13 piglets, per litter. And if she only gives 11, they're probably going to cull her. If she tends to give 15, usually 2 or 3 of them are going to get stuck, and it may mess up the whole batch. They're going to cull her. I mean, their genetics are so tight on these sows, very rarely do we ever get involved. There's a handful of people that do it commercially, and they kind of cover the spectrum of business. But big old long horns can fit a lot of babies in there. And think about this, as you look at the shape of these uteri, remember that they all have different types of placentation, and that will start to make a little bit more sense. This primate uterus resembles probably most closely the mare, okay? Really, basically, they call these actually rudimentary horns. I mean, they're just really non-existent. It's just one big old basket. But you remember what type of placentation the primate has? Zonary, and a very specific zonary in the discoid. I mean, this thing grows roots in one spot. I mean, it buries itself in and creates a deep, deep attachment. My wife's last pregnancy, we lost the baby one time, unfortunately, and then she got pregnant again and went to try to hear the heartbeat and stuff, and they had a very hard time hearing it, and that was the same time she lost the first pregnancy. Well, come to find out, she had a frontal attachment of her placenta, so, I mean, the sonogram couldn't even pick up the sound wave on a 12-week, pregnancy because it's that thick, okay? So they really, really vary in when they're going to make their placentation. All right, so let's look at this cow. When we go, and we will, on Wednesday mornings here in a few weeks, we're going to start palpating, and we'll palpate cows, and we'll palpate mares. Dr. Bridges will probably help with the mares, and some of y'all will come out to the pasture. What our goal really is to find the cervix, okay? Find the cervix and then try to find these horns, and don't get concerned about all the details just yet, okay? But appreciate on this schematic how curled up those horns. These horns definitely have a greater curvature as you get up there to the midpoint of those horns, and they really, in a natural, open, or appreciate from the schematics is all the connective tissue that's associated there. The peritoneum is actually being reflected over and covering this thing as well. So there's a lot of connective tissue. If it's open, it's going to all be right there on the pelvic floor, in the pelvic canal. Now, being mindful that the more time she gets pregnant, the more we stretch out those broad ligaments, and the faster and deeper those pregnancies will drop. So you can go in there and palpate a heifer, and she may be 3 or 4 months pregnant, and that thing is still riding really, really high, and you may go palpate a 75-day pregnancy in an 8, 10-year-old cow, and you can barely reach it. It's just sagging all the way to the bottom. It's just, it's just the fact that she's losing the elasticity of all the support structures there. Which is amazing. There was a show one time, I just thought about this. There was a show one time on one of these animal shows, National Geographic or whatever. They were putting cameras inside the abdomen of pregnant animals. And this one show was about lions and big cats. And they were filming these females, pregnant females, hunting. And there's like this bizarre like suspension mechanism inside the female to keep it from, slamming around in there. And then you think about their placentation, which is zonary, really thick, big band. You guys seen puppies and kittens have that green, stuff, all that bilirubin stored in there. So, that placentation, it just all the way it all works. It's amazing how it all works. But anyway, so with the cow, what kind of cervix does the cow have? What kind of tissue types are we dealing with? So we had a fibroelastic penis. We actually have what we call a fibrocartilaginous cervix. So it is fibrous tissue that is so dense, it feels like and it supports and acts like cartilage. Okay? There's no cartilage there, but it is so dense and it is so rigid. There will never be any palpable differences when you feel of that cervix on a cow unless she's about to give birth later on today. Okay? You reach in there, a cervix is a cervix. They vary in size based on breed and stuff like that. You get these long-eared cattle and extra skin, and they tend to have a big old cervix, and the bulls tend to have a big extra sloppy previews. All that extra tissue affects almost every part of them. But you can see the little squiggly lines there through her cervix indicating this canal, and the squiggly lines represent rings. These ruminants are going to have 3 to 5 cartilaginous rings, okay? And so that is helpful. It makes it a little bit more challenging to pass your insemination rods and do flushes. But once you get the hang of it, typically with those 3 to 5, most of the time when you first start out trying to do those techniques, you'll actually count. If you count 2 or 3 clicks, you feel like, okay, I'm about to get close and I'm about to be in the lumen of that uterus. So there is a defined canal there with cartilaginous rings. Those ovaries, you can see how it almost makes one full rotation with those horns, and those ovaries kind of appear to be suspended pretty high. They don't really ride that high. Everything's kind of laying flat, and it's so flat that if you take a real track, you get to see a real uterus, and you flip it over and look at the bottom side of it, the whole bottom side and all that connected, the intercorneal ligaments and stuff, it's just flat. It is meant to lay up on the floor of that pelvis. So remember that she is polyestrous. Everybody remember what that means. We're going to talk about that a little bit more. And she's intended to have one offspring. And we used the example yesterday talking about free martins, right? And it is because they share that placentation. Remember, she's going to make placentomes with carbuncles and cotyledons, making them together make a functional placentome. Look at these horns. You see that left horn? And you see that the right horn is drastically larger. So that's an obvious thing that we can see. That's something that you should be able to feel. Most likely, this cow probably had a recent pregnancy in the right horn. Usually, there's always going to be some horn disparity forever. Okay, that horn usually never goes all the way back to that sweet little heifer size once it's been out. But that's about your average, palpation of a postpartum cow, about a month postpartum. You can actually feel that differentiation in horn size right there. And those are things that you're gonna have to, be significant if you want to palpate cows and help people, understand. I think that happened in one of the labs we had recently. Y'all remember that? There was a calf all bawling the whole time, out there. Was that y'all? Or BP or something? And, we didn't find anything that uterus, one horn was bigger than the other. And, we let her go and she ran out there and the calf came up to her suckling. So, and that calf was about 2 or 3 weeks old. So it makes sense. When I say something, sense. We felt that one horn was bigger than the other, there was no fluid, she didn't have any discharge, she wasn't cycling. What does that usually mean? Postpartum cow. Turn around to shoot, little calf that's been bellowing for an hour, goes running up to her and they're all happy again. So that makes sense. You can even see kind of how tortuous there, that cervix is, really dense rings, and even within the lumen of that uterus, it's quite tortuous in there. It's kind of all these wiggly, squiggly canals and stuff. Nothing fancy about, the uterine tubule on these girls. She has all those parts. Remember the parts of the uterine tubules? Yeah, so you have that infundibulum or that catcher's mitt, right? And then you have an ampulla, and then you have an isthmus. Where does pregnancy take place? Where does the conception take place, I should say? So, usually it happens at the ampullary isthmus junction, okay? So, I always remember that by AI. You want to get them pregnant, AI, the pregnancy happens at the AI junction, ampullary isthmus junction. All right, and that'll be important that you know that, okay? So, let me give you another real example. If you want to, we're about to talk about the mare, if you want to treat this mare, and she is known to have post-mating endometritis, I need to flush her uterus out, meaning when I put extended semen in her uterus, she tends to have a reaction. She dumps a bunch of inflammatory cells and fluid in there. That's not a place where a conceptus will take up residence, and so she's going to either be open in 2 weeks when you check her, or you're going to have to treat her very aggressively. How many days can I lavage her uterus, and how long can I treat that uterus before I have to worry about interfering and doing the same things that inflammation is doing? How many days, how many weeks, how long, when does the conceptus end up in the uterus? So it can float around. It's not going to get stationary in a horn until probably day 16. Okay? But I'm asking you, what day does it show up in that uterus? So it's going to float around in the uterus from day what up until about day 16. 4 to 5. 4 to 5 days. So for 3 days after we breed her, we can lavage her uterus very aggressively. And then anything I put in there on day 3, I have to make sure it's gone. Okay, that she has absorbed it and cleared it on her own by day 4, because there's going to be hopefully a pregnancy drop down that uterus. And it's not going to be, like to be bathed in hypertonic saline or iodine or whatever, kerosene, whatever you decide to lavage her uterus with. It needs to be gone by day 4 or 4 and a half. Does that make sense? Because if you don't know where that happens and why that happens, you're never going to properly lavage a mare. Okay? Form equals function. So this mare's uterus, a lot more concise. Pretty much is this nice little Y or almost T shape. We will palpate the cervix. What type of cervix are we dealing with? Muscular. What type of penis did we have on the stallion? Musculo-cavernous. So we're going to have this muscular cervix. Do you think with that muscular or hemodynamic penis on that stallion that exponentially changes in shape and size, do you think we're going to palpate any changes in shape or size to this cervix? Yes, see how that goes together? So we're actually, you can go out there and palpate a mare, and you know how to grade a cervix. You can probably tell me 75% or greater of the time what are on her ovaries. Because I can tell you which phase of her estrus cycle she's in, and thus I know what her ovaries are doing. I know what the major dominant structure is, and I know the hormone that's influencing her cervix. I'm just going to palpate her ovaries just to make sure I'm right. Okay, that's what you have to understand. And we'll talk about how to do that. But this is why anatomy is important. Why understanding the form, the materials, the tissues that make up that cervix. Okay, so here is the thing. You see how that. You see how this mare's shape here. This is going to be the floor of the pelvis right here. Okay. And you see, just as we get to the body of this uterus, all the horns love to hang and lay over and kind of suspend out into the abdomen. These ovaries are actually, in fact, really, really high. They're suspended up really, really high. Short, super short, broad ligament. That's not going to stretch a lot like that cow does, okay? So you can train monkeys to palpate horses. It's all in there, and it's all in the same place, from mare to mare to mare to mare, okay? You go in there, you'll find that cervix about wrist deep. You go just a little bit farther, I will actually take my hand and cup it over the body of that uterus and pick up, letting it suspend itself in my fingertips. And I'll walk out to one side, about the point where you can barely reach, you have to completely supinate your hand, there's the right ovary. Come back, there's the left ovary, okay? And if she's a big Shire or a Clydesdale, we'll stand in a chair or a box and really, really dig off in there. You can find. So, but here's the problem. You see that shape, that normal anatomical? They're showing you a drawing of what they consider normal. You see that pendulous dip to those horns because those ovaries are super high? Do you think that could cause a problem down the road? Yeah. We have a lot of these mares that in their late teens and 20s, they're cycling fine. They're in great shape. They probably could carry a foal. They could probably get pregnant. They just don't keep it. Why? Because their uterus pulls fluid. Urine collects in there. It's if they've had several foals, that uterus tends to sag, and it's just normal stuff, normal cellular turnover that doesn't get flushed out, and it kind of just makes the septic tank in there. And there's even a procedure laparoscopically. You can go in there, take the mesometrium. You can get a mesometrium tuck, okay, and they'll tighten that thing up and resuspend it up high, and it's good for one pregnancy. Okay, and if then you can go back in there next year. We can do it all over again. But understanding what's normal leads us to what can go wrong with it, and then somebody's going to tell us to fix it. All right. So again, really, really short horns there, and ovaries are kind of way out there. Ovaries are going to be much bigger ovary than in the cows. And anybody know what's uniquely different? Let's back up. So she is seasonally polyestrous. Okay, what does that mean? She's a long day breeder, right? And so right now mares are kind of on winter break. We'll start checking a few mares here. By the 1st of February. Some people may in the next week or two before January is over put these mares on their lights and start trying to transition them. And remember, so it's not so hard to pass your AI infusion pipette and get those things. Most of the time, on a mare that's in standing heat, I probably could get my whole hand through her cervix. Okay, it's that pliable, and that muscle has relaxed that much. Okay, when we think about the shape of that stallion's penis, anybody ever seen an erect stallion penis? Okay, the glans penis on that thing will get bigger than your head. Okay, it will enlarge to that kind of degree. So we have to say, wow, why does it do that? Well, if she has this super soft, pliable cervix, that thing, and he won't bail and completely balloon like that until he's made intromission. So right at ejaculatory threshold, that bail really only fills up with blood, and what happens is he's literally filling up her entire vagina. He's opening her cervix. He's probably ejaculating directly into the uterus. Okay? So every species is going to be a little bit different. You know, why does it do that? Why does it do that? Form is going to dictate function. So it's not hard to get in and out of a mare's cervix. That little short body, or excuse me, in the cow we have that tiny short body. You see the big circle there that dictates that body. There's a lot more functional tissue there, but because we have a cervix that's so dynamic, anybody know that know what could be wrong or what we worry about with a body pregnancy? So we prefer these mares to get pregnant and stay pregnant down in a defined form. But because it can move around, it could land in the uterine body, and it will develop, and most of the time they do well, but they can run into problems. Anybody familiar with that? So eventually what happens is, because that cervix is so big and so dynamic, there's no functional endometrium there, okay? And so they can lose a large portion of their interface in a body pregnancy. So you have to be concerned about those body pregnancies, and you're going to do a lot more gestational monitoring, getting those mares to come in and do fetal heartbeats and stuff. So what did I say? Okay. So when anybody ever seen and we're going to talk about this in far more detail. So this cervix, because it is so dynamic and it can change shape and size so much, there is not any functional placental tissue there. Okay? So your membranes develop, but there is no real placental interface. There's no attachment. There's not drawing any nutrients from that portion. Now, what type of placentation does the mare have? Do my hands doing this? Does that make it better? Because I just constant. That sounds right. Now I'm doing this for about 2 millimeters. Probably got it right over the top for some of y'all. So what kind of placentation does the mare have? Microcotyledonare is one way to say it. So there's endotheliocorial, there's epitheliochorial, and then it's like Velcro. There's just millions and millions and millions of tiny little superficial connections. Right? So when we think about that, we back up and we said, if we said zonary, things like placentomes in a cow, where they are these zones of placentation, and those connections are going to be pretty deep, right? They're going to be endotheliocorial. You can read those books and you can try to understand all those layers if you want to, or you can just back up and think about it from a common sense standpoint. The more concentrated the connection is, the deeper it's going to be. If I'm going to take my surface area of life support and line it all the way down into one disc, like in a primate, that's got to be a really good connection. Right? It's got to be very deep. It's going to be endotheliocorial. Okay? It's got to dig deep and find some big blood vessels. If I'll spread it out over the entire surface area of both horns and the body, just minus what tissue is located around the cervix, then I don't need a very deep connection. They got millions of tiny superficial connections. That is, in a nutshell, that's a mare's placentation. Okay? But if we land that pregnancy in the body, we know we're going to lose interface of functional placentation, okay, which we will at the cervix, and it's called a cervical star. We'll see a picture of a placenta or a mare's placenta at some point. Then that mare, or that foal, actually, is going to be potentially in danger from not having as many adhesions or interface connections for placentation there. Okay, does that make a little bit more sense? Chip?
So to kind of summarize, so pretty much there's a possibility that a portion of the placenta will lack nutrition.
It is like the cervix. Never does the cervix, attachment. There is, chorioallantoic membrane that covers there, and it is sealed, and that's obviously where that placenta ruptures, interface between the mare's uterus. It's a completely different type of tissue. there is no real endometrium there, okay? It is epithelium, okay? It's stratified squamous epithelium. It's not endometrium, it's not a mucosal surface, it's not a functional glandular surface. So, if you didn't get that, don't worry about it. Okay? We're going there, okay? It's just an example of making you try to think about how and why things are the way they are, okay? So, monotocious, we said that, she's meant to have one. Who does better? Who does better? Cow with twins or mare with twins? Every time. That's usually going to be the answer if you ask that most times about a situation between a cow and a mare. Other than running a race, most times your answer will be cow. But that cow, and it's because she's got a little bit more uterine space there. And again, because of all that, even though we have this larger body, it doesn't contribute to placentation as efficiently as it should. And so if we get double the occupants in there, we really start losing the central interface, and it just doesn't turn out well. Okay? All right, so nothing else, nothing fancy there. You do think about things like this. You see how much more vagina this mare has. Well, we just talked about the stallion's penis and shape, okay? She's got this large vagina. He's got to be able to fill that thing up. When you put your hand in the vagina of any, adult bovid, you have to ease in there. It's not a very wide vaginal canal. You can just, you can slide your hand quite readily in and out of the mare's vagina. It's just a much more bigger space. That being said, she's got to have a much more functional anatomic barriers. Okay, we'll talk about this. There's 3 defined anatomical barriers. There's the vulvovaginal seal, there's a vestibulovaginal junction, and then there's a cervix. Okay, all those things have to be intact. We'll talk about those when you go through a BSc on a mare. All right, so here's the sow. Again, a little bit closer to the cow, okay? Even that boar had that fibroelastic penis, but he had a corkscrew glans penis, or free portion of his penis. And look how this sow's uterus kind of corkscrews back up on itself, okay? But, again, she typically is going to have 12 to 13 piglets. She needs a lot more room. Age, with having that saggy uterus and that very first little piglet, if he's coming, dorsocranial like he should be, oftentimes his little snout or his front legs will get hung up under the brim of that pelvis because it's dropped so low. And that's another problem with those girls who tend to have 14 or 15 or more piglets, is the uterus gets pulled so far down that little piglets will get trapped under the brim of that pelvis. Okay. So, super long horns, she too has that rigid cervix. They even, with that rigid cervix, so when you AI sows, which I'm not going to pretend like I do that, I've never done that, I don't care to do that, but the AI gun, there are even models that actually have, it looks like a plastic molded screw. You take it in there, you think you're at the external loss, you pass it blindly, and you just turn it like you would screwing a screw, and it will lock into that cervix. And then you can push your semen in there. Or has a corkscrew ability to the free portion of the penis. It's not by accident, right? Polyestrous, meaning she should cycle all year long or all year round. That is true for our domesticated swine that are indoors, okay? But if you look at wild hogs, and we have a bunch of them in this area, unfortunately, they probably do have seasonality. It would not be advantageous for her to be putting piglets on the ground, when they're born hairless and it's cold outside. Doesn't make very much sense. You go walking through the woods, there's taking much time in the summertime when it's nice and warm and they love the mud and they root and dig around. You can't hardly find one pig by itself. And they're highly fecund. What does highly fecund mean? They make a lot of babies really quick. Okay? 3 months, 3 weeks, and 3 days. She'll have a litter on the ground and she'll cycle back and be ready to go again. They can, turn over really, really quickly. All right, let's see. There, here's the bitch. Rather, a little bit more straightforward. You guys have probably seen more dog and cat uteri from spaying cats and dogs and seeing that happen. Okay, still fairly long horns, but they're just a lot more straight in nature. There's a pretty good body. You can see how open the body is there. One thing that's really unique is something about that cervix. It actually, that external os is actually pointing downward. Okay, so it is impossible for you to blindly pass an AI rod on a bitch. Her cervix is going to be looking at the floor of her vagina. So when did I picture that? I do. Good. So moving from left to right, we're moving from the uterus or from the peritoneum to the outside. Okay, so that opening to the right side is going to be where her vulva is. So all the vagina is to the right. Notice it has this cul-de-sac or blindly ended vagina towards the front, and then how that cervix turns completely, 90 degrees with the floor of her pelvis and pointing straight down. So what did we talk about? How the male breeds this female. Copulatory tie, right? So he is going to make intermission, and you can see how that vagina narrows. So remember, what was that part of his penis that's going to be the most important part? Vulvus glandis. You can imagine that he gets his vulvus glandis seated right at that narrowing, and then that thing fills up with blood, he is going to get locked in there. And then when we learn about his ejaculation methods, what organ was the only accessory sex organ that he had? The prostate. Well, guess what? It makes a lot of fluid, okay? And he's going to fill up that entire cul-de-sac and all that dead space. He's going to just completely fill it with semen, and when it does, you can imagine straightening out a little bit, that downward pointing external os, and he's going to use fluid pressure to force that sperm up into that cervix. So he's going to ejaculate, and then he's going to follow it with an enormity of prostatic fluid. So deposit the sperm, wash it, or increase the fluid pressure by chasing it with a large amount of prostatic fluid, and it's going to float those sperm up into the uterus. So when we're collecting a dog, AI female, we're going to get our semen, and we're going to be done with him, but he's going to stand there and continue to ejaculate prostatic fluid for quite some time. Way more prostatic fluid than he actually gave you ejaculate. But we don't need that to AI, bitch, especially if you're doing transcervical or TCI. All right? So polytosis, right? She's going to have a litter, have a bunch of babies for us. And there's the old boy doing his thing. So he is literally, once he makes intromission, he is going to, swing one leg over, and they are actually going to end up completely facing in opposite directions. So you imagine when we looked at that penis, that root of the penis, how it heads towards the rectum and then completely turns, it really almost ends up in a 180-degree level plane, coming straight out his backside. That thing is I get two tails back there. So, let me see what else I got in here. Alright, so here's our little plane. And again, y'all seen this uterus. Take a bunch out, throw them in the garbage can, spay these girls. So not much different than the bitch, okay? Anatomically, very, very similar. Let me back up. Here's a form equals function scenario. Anybody know, I asked you guys about the uterine tubule of the cow. Anything unique about the differences between the cow and the mare when it comes to that uterine tubule? Anatomic. remember anything? I'll give you a hint. It is at the uterotubule junction. So where that uterine tubule opens into the tip of that horn. Is there anything different there? Like there's a gate there, a little door. There is actually a sphincter there in the mare, okay? There actually is a uterotubule sphincter, okay, at the uterotubule junction. So it is muscular in nature. It will open and it will close. So why does that matter to us as veterinarians? Does it allow us to do anything, or recommend that we not do anything based on anatomy? Not to do anything. So it depends on what species. When we're talking about the mare, what example did I bring up about, knowing where that embryo is and where it lands? What did I say we're going to do to these mares when we breed them? We're going to flush their uterus out. Anybody want to flush a cow's uterus out post-breeding? I don't recommend it. Now, you may find some knucklehead doing it, but because they have that uterine tubule sphincter there, or let's say the cow does not, where is that uterine tubule actually opening to? The body, what? No, I mean on the other end. So let's start at the tip of the horn, and you said you had an ampulla, we had isthmus, we had infundibulum, and what does the infundibulum open to? I mean, it's around the ovary, but do you know where the physical opening? Yes, and that's where I'm going with this. So it actually opens to the peritoneum. It has a couple of little attachment points, and it's basically this big catcher's mitt. So when this cow ovulates, we're in the bitch, we're to the peritoneum. I mean, this is like the 8th wonder of the world. I mean, this is amazing stuff, okay? And we got this big catcher's mitt of an infundibulum that funnels that little microscopic ova, saves it from going into the vast beyond of the peritoneum, and brings it down in to the infundibulum, down into the ampulla, and hopefully right there, at the isthmus, we meet some spermatozoa. That's pretty amazing, right? That's pretty amazing. So if I increase fluid pressure in this cow's uterus, if I start trying to run a liter of something in a cow's uterus, where ultimately could it go? Into her abdomen. Absolutely, 100%. What was that girl's name? AABP. Mary Stewart. Mary Stewart. Sweet little Mary went and rode around with a couple of dairy vets, and they went to a dairy where they ended up cutting like 2 or 3 DAs. They had some LDAs. All of these cows were about a month postpartum, and that's not uncommon, and you need to understand why. We'll talk about that. But they started doing these DAs, and all of these cows had postpartum metritis, okay, so an inflammatory condition in their uterus after calving. And when they start trying to attach that, correct the displaced abomasum, and they want to do some type of tie-down procedure, one of the most common techniques is to manipulate the greater omentum. And so as they would find, and that's kind of a landmark, as they would find that greater omentum, and in every one of these cows, I think it was 3 of them, every one of these cows, the omentum was green, like a neonish green, like this bluish hue green, okay? That fat is typically a really golden yellow color, and there were just stains of green stuff all over it, and they'd never seen that before. And so she did, just like y'all's generation did, she whipped out her little smartphone, took a bunch of pictures of it, and she texted me in the middle of the day, and she wanted me to answer her, within 30 seconds or less, When I didn't answer her, she texted me again, and thought I didn't get the pictures, so she sent them again, and that's what y'all do. I got a problem right now, and I need an answer right now. So eventually, when I got these pictures, Um, weird. You know, it really is weird. Anybody have an idea? So, infection from the uterus rolling out in the abdomen? Probably not. Probably not. It's a good thought. I mean, that's logical. Okay, I told you they had, endometritis. That's at least using common sense. I appreciate that. That's a logical thought process. That's not real, but that was a logical thought process. And I appreciate that. Anybody else?
Like antibiotics?
So, she just gave me that quick signal, and I said, anybody been, what's our postpartum treatment here for this new trial? Oh, well, I was gonna ask you about this too, but they've been lavaging these cows like every other day with chlorhexidine. Yellow and blue makes green. It's fat on the floor of the abdomen. They're with a pump, pumping chlorhexidine into the uterus of the cow. Too much pressure. It's blowing out the uterine tubule into the abdomen. So they're like car washing the ovaries with, dirty blue water, and where's dirty blue water, and where does it go? It all settles out on the floor of the abdomen. She eventually is trying to reabsorb it, but that blue fluid stained the fat momentum green. Now, if you don't know your anatomy, you don't figure that one out. Y'all, I was so excited I couldn't go to sleep that night. That was awesome. I mean, that was awesome. Like, I wanted to come down here to class and tell somebody else, what I had discovered that day. Yes.
So when you're treating like retained placenta or something that that you can't get to release, I've seen some that flush the uterus. So is it different? Like, do they just know the pressure they release?
So, and that's a good question. And listen, there's always more than one way to skin a cat, and there's different ways of doing things. There's always more than one way to skin a cat, and there's different ways of doing things. Most of the time, if you are trying to release a placenta, you're actually pumping the fluid back into the placenta. So you're trying to fill the bag up and stretch that uterus out again, hoping to break those endothelial or epithelial attachments. Does that make sense? So we're not trying, and people, don't get me wrong, people do, and I know people that have definitely lavage a postpartum uterus. Okay? But the theory is when you do that, again, our golden rule is in all things do no harm. Okay? In all things do no harm. But if I just pulled out in pieces fetus that had been in there for a week, and it was dead, and there were flies coming in and out, through her cervix, like that was a gateway to paradise. I feel like I gotta try to get some of that hair, or loose teeth, or bone shards, or whatever else is in there. And so we oftentimes will do a lavage, but with gravity feeding, meaning I'm gonna pass a large bore tube. I oftentimes keep that tube in my hand, so it's not pounding against the uterine wall, so it's kind of dispersing it in my hand, and I'm gonna hold the end tube up with a funnel, and somebody's gonna stand in the chair and pour fluid into that tube. I'm never gonna pump it, I'm never gonna force it, and so I'm gonna pour some in, and as soon as I feel it feeling back up towards my hands, I know I've filled those horns, I'm gonna stop, and I'm gonna use negative pressure to siphon it back out. Okay, and then I'm immediately going to treat her with ecbolics. What are ecbolics? No, don't use those either. Ecbolics, those are drugs that cause uterine contractions. Okay, ecbolics, give me an example. Oxytocin, right? Or what else? No, that's interesting that you say that, but no. I don't want to chase that rabbit yet, but remind me. Prostaglandins, PGF2 alpha, okay? And they do it in a little bit different way, and we'll talk about all these things, but I'm just saying this stuff, okay, because I want you to see where we're going. I want you to understand why I have to know the anatomy so that I can push this mare and and the physiology of when that, you know, conceptus falls down in that uterus, so I can do real veterinary medicine, okay? And again, we've all done things in dire circumstances, and I've lavaged plenty of cows, and I've put antibiotics in there, you know, and I've done all the things that you're not supposed to do, but we all had good reasons, and it was justified at the time. And sometimes you're just trying to save their life, okay? Sometimes with these cows, remember, she does always have a value. That mare, you know, I did a dystocia on a mare last year where I had to do a phlebotomy on a mare, and that was always a dangerous situation. I did it on the farm. I used a tractor, completely anesthetized the mare, picked her upside down by her back feet, and I pulled the foal out a piece at a time. She had some cervical damage. She stayed in the hospital for a month. We did lavaging, you know, numerous times a day. She's probably ruined, but the mare was a wedding gift to this couple, and they wanted her to live as long as she could live. And so she's probably not gonna have a foal, so we did everything we could to save the mare, you know, and not worry as much about long-term uterine health. If she was a cow, well, if she can walk through the sale next Tuesday, you know, she's got a dollar bill hanging off of her neck. So I've done some things to make this cow live, knowing we shouldn't do this if we plan on her going back into the milk line, okay, in a few weeks. So there's a difference there. Oh, hang on somewhere. Yes.
I don't mean to back up, but I somehow got a little, excuse me, everybody, so like, between the whole lavage and then the whole junction, it's kind of a little jumble. So like, you lavage mares before they mate. Is that what you're trying to say? Or
Or they what?
when the lavage thing was kind of killing me. I think.
Don't worry about it.
So.
Don't worry about it, 'cause we're gonna talk about it.
So the whole junction thing you were saying, like, just that concept between a mare versus a cow.
Yeah, so there is one in the mare, so there is a closure. So that uterine tubule is physically completely distinct and separated based on that muscular wall.
Right.
The cow, there is not one. Yeah, so if we exceed the capacity by putting too much fluid, we fill up that lumen, it's gotta go somewhere. It'll come back out on us, the pumper, which it does, but some of it's gonna be forced down in those uterine tubules, and they ultimately open to the peritoneum. So whatever we're pumping in that uterus, they end up in the abdomen. Now, that's not to mention, think about this, if we're postpartum, I'll say this and we'll stop and take a break. If we are postpartum, okay, think about what the endometrium looks like right now. Is how geared up do you think it is to absorption of foreign materials? Do you think it is above average or below average its ability to be an absorber to surface? Above. Why? Because we were just supporting something. We increased blood supply to those areas. So not only could we flush stuff back into the abdomen, whatever I put in there could be, and most likely to some degree, is absorbed systemically by that cow at those placentome sites. Those caruncles still probably have some, capacity to absorb stuff, okay? So there's lots of reasons why we shouldn't do it in the cow. Another big reason no in the cow is because there is no drug that is labeled for intrauterine infusion. So if we'll talk about Anduca and Fairad later, but if there is a drug that's labeled for it in food animals, you have to use that drug. If there is not, and there is evidence that medication, even if it is approved for use in food animals, and it's all now off-label, I can do that because I'm smart enough to say that should work. But we don't know what milk and meat withdrawal would be if you were to put a uterine infusion in the cow. Anything that goes in the cow comes out of the meat or comes out of the milk. Every single thing. And so nobody knows how long, if I put some LA200 in a cow's uterus, what would be the meat and milk withdrawal? Nobody knows. So just another reason, right? Why we should do that. All right, let's take a break and we'll circle back in a few minutes. 10-minute break or so. going to tear, right? Physically tears open. There goes the oocyst inside all of that, oviduct, or all of that, fluid, the follicular fluid, and we've got to get that thing caught. So these little tiny little lips here, typically when not manipulated, they're probably like to hang out way more over here and completely surround that thing. But it can be removed. You can completely peel the infundibulum off and expose the ovary. That is why people recommend when you breed cows that you not manipulate their ovaries on the day that you're palpating. Okay, it'd be nice to say, oh yeah, that's a real big soft follicle, she's probably going to ovulate later on today. You do that, you pull off your infundibulum, and where does your oocyte go? Lower the abdomen. Doesn't mean no good there. Okay? So we try not to manipulate the ovaries. Now somehow, when you manipulate it, and eighth wonder of the world was the fact that it gets down in it, the ninth wonder of the world is the infundibulum as well, and how does it get itself back over the ovary with no muscle cells and no brain and no, I don't know. You know what the 10th wonder of the world is? Anybody know what the 10th wonder of the world is? 10th wonder of the world is, how come when a calf is born, you can take any absorptive material that you own or have ever seen or could find, and you cannot dry that calf off. But the mama can come over there with a wet tongue and it'll be dry in 30 minutes. Any sense? So, here's our uterine horn over here. This is depicting the lumen. So, this is probably, right there about that greater curvature of that horn, and then we're going to do that curl back on ourselves, and there's my ovary. Everybody understand that? You can't feel this infundibulum or this ovarian bursa. Okay, you can't feel this. Some people say they can feel the oviducts on a cow, palpating through the rectum. I used to say, bull, you know what. And then one day, I'm pretty sure I felt I could feel the oviducts on this cow. Then I convinced myself, maybe you can, but it ain't good. Because guess what she was there for? An infertility work. And I think she had salpingitis, which is inflammation of the uterine tubules, and her oocytes were never getting all the way down, nor were sperm getting all the way up. They probably had no lumen. So, sense. I can buy that now. So, everybody follow me on that? So, if we look at a U, very similar. Okay, very similar. We have this tortuous oviduct. Here's the tip of our uterine horn, okay? And it's going to terminate, and we can see our oviduct coming up like so. Here's our infundibulum that has been peeled off. So normally this margin along right here would be wrapped all the way around, okay? See this CL? What's a CL? Corpus luteum, okay? What does corpus luteum mean? What does corpus mean? Body. What does luteum mean? It actually means yellow or gold. So now, that being said, somebody said white. Anybody know what a corpus albicans is? That's white. What is a corpus albicans? It's a scar. That's a scar. Exactly what it is. That right there is probably a corpus albicans, which is, we have a follicle. If she ovulates, remember she is going to rupture that tunica albuginea. Blood is going to rush in because we have torn all those vessels, or we had to tear some vessels. That ovulation depression is going to fill with blood. When that blood becomes one contained, the tunica albuginea the blood will actually clot and plug that hole. Blood do? Turns into a clot. What do we call a blood clot in an ovary? Corpus hemorrhagicum. It's just a body of blood, right? So if I was, I'm just gonna pick on Chad, just because I know Chad, and if I was to have had my feel of Chad today, 3:15. And while he still got his backpack on, holding both straps, I just sucker punched him right in the kisser. Okay? Got him good. What's Chad's lip gonna look like in a little bit? It's gonna start swelling up. Why is it swelling up? I ruptured some blood vessels, right? Now Chad rolls up in here if he dares show his face tomorrow on canvas. What's that lip gonna look like? It's gonna be purple, ain't it? Big old purple lip, Marty lips. Big old purple lip, okay? We'll have a fat lip. Now why is it purple? Because we got a bunch of clotted blood that's in the interstitial spaces, right? Ruptured blood vessels. It's contained now. We didn't have broken skin. If I split that lip, it had to go home with a little tissue, right? And be wiping it. And that's why when boxers fight, why do they cut their eyelids? Get that hematoma out of there so I can see, right? Right now, tomorrow is Thursday, and let's think about we meet back for class. We're gonna palpate cows next Wednesday morning. What's Chad's lip looking like on Wednesday? Kind of greenish, little amber hue or a little tone to it, right? So why is it look that color? Yeah, we send out hemosiderin and they break down all the iron and the loose blood. They start breaking down those red blood cells. If you have a container of blood and you went over here and spun it down in those little whirly birds like a centrifuge, what happens to it? It divides. We separate what and what? Serum on top and what's on the bottom? Plasma, all cellular matters on the bottom, right? What color is that serum? Nice and yellow. If we have free blood in the interstitium or a defined body cavity, and we send in cells to take all the cellular matter out, what are you left with? Serum. That's why your bruise looks yellow about a week later. Cleaned up all the cellular debris. We still have some serum left in there, and the body will eventually take that stuff up and away. Okay? It's no different than this corpus hemorrhagicum. No different. It's exactly what's happening. Okay? And a lot of times, and again, we'll talk about this more. Okay? I'm just trying to plant some seeds so you guys understand where I'm going with all this stuff. But that's the same thing that happens when that cow ovulates or this ewe ovulates. Blood rushes in, fills that cavity, the body organizes into a clot. We start sending in cells to pull out all the dead blood cells and inflammatory cells that were there. And when you do that, you're left with a cavity. Okay? We know that we're going to send in luteal tissue and fill up that dead space, but many times, and we'll talk about this tomorrow or Friday, many times in the middle of the CL, if you have the opportunity to dissect enough of these things, you'll slice through the middle of the CL, and in the very center of it, it's almost like it has a little cavity, and it'll be full of this nice golden colored fluid. What do you think that is? It's serum. It's just leftover serum from the destruction of the tunica albuginea and that blood. Okay? It's that CH that has been digested. Okay? And a lot of people they'll ultrasound these cows' ovaries and oh, look, there's a cyst, there's a fluid. No, oftentimes they're not. Oftentimes they're just serum. Okay? And they call them a lacunae, and lacunae just means lake, so it's a lake of serum in the middle of this CL. It happens. It's not pathologic, it means nothing. It is that normal process of getting rid of that blood. Okay? There's a little bit of serum. If that CL, if we want to talk about that ovary in terms of Chad's lip, it's about a week later, and it looks kind of greenish yellow, and still got to resorb and get rid of all of that serum. Okay? Y'all follow me on that? All right. Let's see what else we got here. Again, these pictures are all come out of Singer. Okay. Excuse me. Pathways to pregnancy and parturition, author of Singer. When you're in the cool Therio circuit, we just call it Singer. So look at this sow's ovary. What kind of female did we describe her as compared to the mare and the cow? Polytocious. litter bearing species. Who else is polytocious? Dogs, cats, right? The opossum, you know, there's lots of them out there. Now, look at her ovary. Looks kind of lumpy and bumpy, and there are some CAs up there. See, oh, that's where we were going with that whole discussion. So after we get to CH, we have a CL, and then we land finally with a scar. If I split Chad's lip, he's always gonna have a little crooked snarl there, right? That he'll always look at his mirror and be reminded of me. Never forget about me. He got an old portable salad cans on his lip down there. So we will see a small white scar many times on one of these ovaries if you're dissecting them. That's the exact location that tunica allogynia ruptured and released that oocyte. Pretty cool, huh? All right, so it's not just some anatomical structure. It actually means something that's worthy. So notice that this sow has a bunch of CAs, and those are going to be really big CAs. Those things are going to get smaller. They really reduce down to just a speck, and as do scars. Scars change shape on our skin over time as well. But those CAs will regress. Those are probably actually late CLs, and not just CAs. But why would she have multiple ovarian structures present at one time? There's 2 antral follicles. There's 2 CAs that we can see there. I don't know what O is supposed to be. Go back and look at the book. OD is the oviduct. So let's follow this thing. At the bottom down here, here's where the uterus would attach. Here's where the oviduct starts. It's going to wind itself all the way back in here. And here's our infundibulum, okay? And this little margin right here would be pulled down to cover this whole hole of this ovary. But really big antral follicle, really big antral follicle there. That's what a CA is going to end up looking at, like that white speck. So these are still, in my mind, these are regressing. If you open this, see that little golden hue to that guy? If you were to slice that open, there would be luteal tissue in there. It's not functional because we've moved on, but it has to regress. So anyway, why does this sow have all these multiple antral follicles? Yeah, because she is polytocious, right? Now here's the interesting thing. This sow, or this bitch, and remember in cartoons, Lady in the Tramp? Okay, Lady in the Tramp. Let's take Lady in the Tramp. Lady comes into season, right? They didn't get her spayed. Of course, she went through puberty. So she comes into season. Got a fine stud dog tramp around, changing his ways, trying to do a little bit better. And obviously they have some relations because 63 to 65 days later, up showed this litter of puppies, and what they look like.
Like her, and then one look like Tramp.
Now, always in the cartoon, there's a whole litter that look just like Mama, that are really well behaved, and there's one derelict male offspring that looks exactly like the father, right? Now we know that doesn't happen, okay? But it's not too far-fetched. What is the half-truth in Lady in the Tramp's litter? See, there's no scientific lingo y'all can throw out this time. Bingo. So if she in fact had actually been bred by a purebred Cocker Spaniel hound dog, she could have ended up with a bunch of Cocker Spaniel puppies, and then Mr. Tramp only seeded one oocyte. Okay, she has the ability to mate with multiple sires and deliver offspring different from different sires in one litter. Y'all follow me on that? Okay. Let's just say this: if she has four fertilizable healthy oocytes, Actually, in swine, that's actually what they do. When you order semen to AI your sow, many times it is a mixture of 2 to 4 very well-known boars that stand in that stuff. It's actually proven in the boar, in swine, that heterozygosity of that semen mixture you get actually elicits greater activity from those spermatozoa because they know there's foreign DNA there. So they will become more competitive, increasing fertilization rates than if they're just hanging out with their own single chromosome, buddy that was made in the same testicle. So there is a little bit of half-truth there. So how does that happen? I mean, what's the time frame for something like that to play out? So, maybe a couple hours, a couple of days. I mean, you're all right. The real question is, when this bitch or this sow or this queen ovulates, this polypocious mammal female ovulates, is she gonna ovulate all at one time, or do I do 2 right now and 4 later, or do I do 1 on the hour every hour? Y'all like multiple choice, right? Give me multiple choice. But you follow me? It's not, this sow may ovulate 20 times. And it's not going to be all right now. There is going to be this randomized trickle effect. So if she is going, and that's why the bitch has this fertilizable window of days. And that's why she ovulates what type of oocyte? Primary oocyte. It still has to undergo some changes. So who lasts longer, the sperm or the egg? The egg. And who should be waiting on who? Guys should always be waiting on the girl. Time-tested theory that just can't be broken. Guys will always be waiting on the girls. Okay? I have 5 of them at my house. I could have gone and done what we needed to do and come back before they all get ready. Need to run to the grocery store to get one thing, finish making something. My gosh. Don't wear shoes. Don't wear it. Not even worth it. I could have run to the grocery store. So guys are always waiting on the girl. So she's going to become attractive to males, and she's going to start trickling out primary oocytes. She's not an induced ovulator. She's on her own little clock there. So just in case there's no males around, I'm going to send out a primary oocyte. Now I got some time to finish finding my day. Oh, he's downstairs. He can wait a little bit longer, right? I'm going to do my hair again. And hey, guess what? I still got a few ovulations left. I've been dumped on the other side of the world. Hey, found another male suitor. He's going to need to, propagate his bloodlines over here. So that's what happens. If an alpha male dies in the middle of an estrus, whoever steps up has an opportunity to breed that female in that moment and in that estrus. Okay? So it's all about being able to propagate myself in the most functional manner, or most beneficial manner to me and my bloodlines. Yeah.
So what you're saying is that she'll send out a primary oocyte, which will, I guess, in turn let males know that she's like.
It's not that. The fact that she's an estrus and the pheromones that she emits, okay, and the primary oocyte doesn't know that sperm are there. It's on a clock. But my point is, yeah, the last piece of that puzzle is how long do canine sperm live? A, not very long. B, hour. C, hours. D, days. E, week. It's probably about a week. Probably about a week. He's going to ejaculate, and if they land in the vagina, and he actually finishes copulation, has all that prostatic fluid, he gets those spermatozoa spermatozoa up and into the uterus, and they make them their way to the oviduct, they probably have almost a daggone week of a lifespan. They are some kind of hard stuff, okay? That is potent stuff. So you understand, she's got this mechanism to spread out her ovulation. It's not even a fertilizable oocyte, and it gives her a long fertilizable window. Okay? Everybody's seen a bitch in heat. Feels like it's forever, right? I mean, it really does. And that's part of it. I gotta make sure I get ready. It's not just a crucial one moment in time thing. It's a huge window in time. Okay? It's a huge window in time. But as soon as she ovulates, it's over, right? And then she moves on. What does the queen do? If she doesn't find, she just ovulate and move on? Oh man, she kicks it back into gear, she gears down, and she's getting ready for the next one. You know, and that's why if you don't spay your little house cat, it seems like she's in heat all the time. She is in heat all of the time until somebody induces her. Okay? So that's why we have all these ovarian structures going on this sow's ovary, because of her being a polypocious animal, and she's got to make herself in this trickle-like mechanism available to different sires. So now let's look at the mare. Okay, this has not been like chewed on. Okay, that is the real proportional size of the infundibulum. Looks a little bit different, right? Why? Yeah, they only ovulate in one particular area, and it is called the ovarian fossa. All right, and what's unique about the ovarian fossa? Is she gonna shoot this thing out into the peritoneum and have this infundibulum do its job? Infundibulum really doesn't help that much. Okay, it's all tightly adhered. It's more of a closed space, unlike those ruminants where we saw those loose attachments, right? And look at the shape of her ovary. Okay, it looks kind of like a little kidney or a big bean, right? And anatomically, it is set up a lot like a kidney. It has like this cortex and the medulla, and we're going to be focusing just like you would be sending everything to that renal pelvis. We're going to be sending everything to that ovarian fossa. She's actually going to ovulate internally. That's why if I palpate a mare, I can't ever guarantee you if she's ovulated or not, because I can't feel that CL like I can on a cow. I can feel that site at which that corpus luteum will extend beyond the ovarian bursa and be palpable until it shrinks and recedes and CA forms and makes a scar. These mares are ovulating internally into that ovarian fossa. So just by palpating her, I never know if I would have to ultrasound her to see that organized corpus luteum. Follow me on that? All right? So those are the things that between species become different, and and that's why we have different treatments, we have different pathologies, okay? And we do believe there's some oviductal, issues with some of these mares. When we talk about tissue types, they're not necessarily smooth muscles, but the literature often describes them as myoid-like cells. And so they are muscular in nature, but they're not organized to the level of which we would call them a muscle body or a muscle fiber. They're just occasional cells that have the ability to contract, okay? And males have them in the vas deferens as well, and females have them associated with the oviduct there. And so some of these mares, they believe to have oviductal lock issues, or the thing won't get all the way out of the ovarian fossa or bursa and actually drop the conceptus down into the uterus. Well, they're going in now with the scope and finding the ovaries on these mares. We know which ones she ovulated on, and they'll actually spray them with ecbolics, causing these myoid-like cells to contract, hopefully pushing that oocyte and hopefully a conceptus on down into the uterus. Wow. Wow. But if you don't understand that those cells are there, you don't know that's why that would work. Okay? So, again, that's not stuff we're gonna have a test on in 2 weeks. That's gee whiz stuff to kind of just paint this picture of why it is important that we have to understand all of these things, okay? 10:47. We'll just finish looking at some of these pictures and be done. Tomorrow, see what we'll do, we're gonna spend, Thursday and Friday, talking nothing but finishing up, talking about endocrinology, hormones, drugs, okay? And then, I want us to be all on the same page and be done with anatomy, physiology, so we can start talking and moving in a direction, okay? So, we're gonna, we're gonna have to talk about, all the different, cyclicities, and I know you guys wanna talk about pregnancies and palpating cows, there's so much stuff to talk about, but if we don't understand, all this physiology and these anatomic differences, or, just the tissue types, it really, really makes a big difference for you to dictate what's normal from abnormal and being able to treat, okay? Not much fancy there about the queen, she's fairly straightforward. Which is the rough thing, those guys. You can see here with, with her infundibulum here, these are these attachments, okay, of this infundibulum that create this bursa, this cavity in which these, oocytes get, spit out into. And you guys ever heard of an ectopic pregnancy? Okay, that's why that happens. So it's spermatozoa, whether it was a fertilized oocyte, retrograded, flushed out of the oviduct, instead of going into the uterine lumen, it went backwards, back out the infundibulum and landed in the abdomen somewhere, or whether you had, and that to me might be a little bit more believable than some sperm and an egg all fell out into the peritoneum, and that sperm found those eggs. They can happen, But oftentimes, if they get lodged in the right place, say some peritoneum, it's a highly vascularized structure, they'll set up shop, and they will take, and I've seen at least 2 ectopic pregnancies, in the bitch, and they were all breeders, and, I don't know why, but a C-section on English Bulldog, and, you're feeling around, and you're done, and, just for gee whiz, you're like, just peek one more time, and you reach back in there and feel, and oh my God, look at the puppy in there, and there's no way, and then you find out it's in the omentum, it wasn't in the uterus, so it does happen, but that's why, because we have a real opening. It's never gonna happen in the mare, okay, never gonna happen in the mare. There's a bitch. You can see how big that cavity is there. All right, back to that stuff. All right, so any questions about what we've talked about in the past day or two? That is fantastic. Somewhat unbelievable. How many people are going to be in the office before I get there? That's what last year's class did. Drive me nuts. I stand here, how many questions? I get in the office and there's a line out the front door. People that have questions. All right, so tomorrow, I'll see y'all here in a little while. But tomorrow we'll get down and dirty on the chalkboard. So whenever y'all, some of y'all want to help, where's the best place to put the chalkboard? Back there? Turn the chairs around? So when y'all get here in the morning, just swing your chairs around to the other side of the table and face that way. And a couple of you gentlemen will drag that chalkboard back there. It shouldn't come apart. I screwed it all together with some cabinet screws. It was pretty risky shit. Hey, speaking of which, do you know you can't really buy chalk